People with ADHD are often misunderstood and categorized as being unfocused, spacey, loud, disruptive, lazy, unwilling, or forgetful. In many instances, children with ADHD are labeled as bad children. Most people with ADHD have a hard time to stay focused long enough to finish something they started, like changing a light bulb. So what is ADHD? Attention Deficit Hyperactivity Disorder, or ADHD, is a well-known neurodevelopment disorder that interferes with normal functioning and development. There are 3 types of ADHD: hyperactive, inattentive, and combined. Symptoms of ADHD usually arise between the ages of 3 and 5, but are most prominent in the elementary school grades. Approximately 75% of children with ADHD will continue to have the diagnosis through adolescence, and over half of them into adulthood. An estimated 8.4% of children and 2.5% of adults have ADHD. It is more common among boys than girls. In fact, the male-to-female ratio is 4:1. Diagnosing ADHD requires a comprehensive evaluation by a licensed healthcare professional and cannot be done with one single test. Before a healthcare professional, such as a doctor or psychologist, can give the official diagnosis of ADHD, symptoms and characteristics must be exhibited by the student, particularly in relation to their peers, for at least 6 months. It is important to remember that the evaluation includes rating scales collected from parents and teachers, as well as a comprehensive parent interview. The doctor will also rule out other causes of the symptoms, such as anxiety, depression, learning differences, or a medical condition. There are 3 different factors that research suggests could be the cause of ADHD. Research shows that ADHD is passed down from parent to child. 50% of children whose parents have been diagnosed with the disorder have a higher chance of developing ADHD. 1/3 of all fathers who had ADHD as children have children with ADHD. Another interesting piece of evidence shows that the majority of identical twins share the ADHD trait. Researchers have linked ADHD to neurobiological causes, as they have found similarities between people with ADHD and people with brain damage caused by brain infections or frontal lobe injuries. Many studies suggest that women who smoke during pregnancy are more likely to have children who develop ADHD, due to nicotine being a toxic substance. Other environmental factors such as lead exposure or food additives also have been thought to contribute to the development of ADHD in children. The most common type of treatment is medication combined with therapy. The medication that is most prescribed is a stimulant. The types of therapy that can be used are behavioral therapy and psychotherapy. People with ADHD often struggle with time management, planning skills, and keeping various things organized. Organizational training teaches children as well as adults all the skills to help support their success in school or work. Parents with children who have ADHD often struggle and get frustrated with their child. Parenting skills training helps parents of children with ADHD understand it so that they can help guide their child's behavior. People with ADHD have a deficiency of a specific neurotransmitter called norepinephrine. Norepinephrine is a chemical that occurs naturally in the body and acts as both a stress hormone and a neurotransmitter. Neurotransmitters signal molecules in the brain that are released by one neuron and received by receptors of another neuron. This movement between neurons is a message being relayed, kind of as though the neurons are having a conversation with one another. Dopamine is a neurotransmitter that gets released and converted into norepinephrine. Dopamine controls the brain's reward and pleasure center. There are 4 functional regions of the ADHD brain that have impaired activity: the frontal cortex, limbic system, basal ganglia, and reticular activating system. The frontal cortex controls attention, executive function, and organization. The limbic system regulates our emotions and attention. Basal ganglia is made up of millions of nerve cell bodies. It can stop, start, and control desired movements, as well as preventing movements that are not desired. For example, If there is a deficiency in this part of the brain, it can result in inattention or impulsivity. The reticular activating system is located in the brainstem. It not only regulates sleeping and waking patterns, but also plays a function in the capability to concentrate and focus attention. Today we have learned a lot about the disorder called ADHD. We hope that this new information brings a deeper understanding not only of the struggles of someone with ADHD, but of the many successes as well.